Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Joining us today to talk about death doulas providing serenity and compassion at the end of life is Sharon Harris. Sharon is a certified hospice and palliative licensed nurse with decades of nursing experience. She specializes in taking care of chronically and terminally ill adults as well as the elderly. Because she is passionate about end-of-life care and death education, she is a supporter of the Death Positive movement, which promotes death awareness. She is a end-of-life nursing education consortium trained, which qualifies her to provide education and training on end-of-life care and education. How are you doing today, Sharon?
Great, Jason. How are you? Thanks for having me. Happy to be here.
Thank you so much. Looking forward to our conversation. I'm going to go ahead and turn it over to you.
Okay. Well, as Jason said, my name is Sharon Harris. I'm the founder of Serenity, End of Life Doula. And I'll just go ahead and start this presentation by a quote that I think is pretty appropriate. And it's by Steve Jobs. And it goes, "No one wants to die. Even people who want to go to heaven don't want to die to get there. And yet death is the destination we all share." So I chose this quote because the topic of death is taboo in most cultures, most arenas, most audiences. No one wants to talk about it. So my goal and my mission is to, kind of raise death awareness, get people talking about it, having that conversation, planning for it. And yeah. So I'll start again by giving the definition of what an end-of-life doula is. So in layman's terms, I like to kind of compare this to a birth doula, as that person who is there for support for the pregnant mother who's giving birth as she's laboring. So end-of-life doulas, I like to think of us as on the other end of that spectrum. So, there is sort of laboring that goes with end of life symptoms and things such as that. So the death doula is there present, providing that support, guidance to not only the patient or client, but to their family as well. And so I have an official definition of what a national end of life doula is. I'm sorry, about what an end-of-life doula is. The National End-of-Life Doula Alliance defines end-of-life doulas as those who provide non-medical, holistic care and support to the dying person and their family, which may include guidance as well as emotional, spiritual, and practical care from early diagnosis through to bereavement. Now, not to be mistaken as only providing care at that last moment as a person is transitioning or actively dying. No, doulas like to come in, if we can, at the time of diagnosis, to be a support for that patient as well as their family and their support team. So what type of services can doulas provide? And that just depends on the doula, their skill set, their background, what they like to specialize in. The definition from National End of Life Doula Alliance stated that this was a non-clinical profession. So being those who choose to be end of life doulas or death doulas and have some type of medical clinical background, such as myself, they may be able to offer additional services. For example, myself being a nurse, I can offer maybe some clinical services as far as like medication administration, any really direct hands-on care that the client may need. And here's just a list of some things that I do in my practice. So I'll just touch on a few, but won't go into much detail. So I do assist with advanced care planning, and that's helping the patient, client, family just get their affairs in order as far as what their wishes are at the end of their life. If patient or client should come to a point where they are unable to speak for themselves, I kind of help guide to ahead of time, of course, to get that designated person in place that will make those hard decisions for that person at that time. Also do some advocacy and care coordination, where I work along with other healthcare professionals that may be involved in that patient or client's care. Um, and also there's end of life workshops and presentations. Again, going back to that very, very difficult conversation that no one wants to talk about. So the workshops are kind of filled with, little icebreakers, games, just kind of open it up and get people talking. So also there is companionship and mobile respite. I know caregivers that are taking care of their loved ones, sometimes it could be a lot and they need a break. So um, that's another service I offer. I can go in and just sit and be their companionship. Maybe the loved ones or caregivers need to go out and just get a break, maybe go to the grocery store, maybe just want to have a few hours to kind of, regroup. So I can be there in that capacity as well. So also basic household support, which will just, include tidying up maybe the residents or clients' space or area where they are, just basic housekeeping things that they may need. Also, legacy products are offered. There is a memory blanket that I can help families make, where that is something like a collage of maybe the client's family members of pictures they've all gathered together. We can put that on a blanket for them. Also, going to be adding in a new service where I'm working with another person where she does memory bears. And what she does is takes a piece of that client's clothing or whatever and creates a bear out of that. So that's nice. And last but not least, I also do bedside vigiling. And that is for when the client is actively dying or transitioning and needs more one-on-one support, bedside support. So, and then again, the care that I provide is just based upon, whatever that client and their family needs. So it's all tailored to what that family may need. So hospice versus end of life doulas or death doulas. So these two kind of can overlap, but I do think that they can work well together. Hospice, I am a certified hospice nurse. And with that being said, I know that some clients that are on receiving end of life care, hospice care, when they're visited by different disciplines and things such as that, they are limited by, Medicare guidelines where they only have X amount of hours, maybe even 1 hour to be with that patient. So I kind of come in and fill that gap in. Kind of we collaborate together and just work together to provide the best care for that client and their family. And here I have a side by side of some things that hospice does and then what end of life doulas do. So on the hospice side, they plan the medical care. And with a death doula working alongside that hospice agency, will reinforce the medical care plan by hospice. And I mentioned briefly that hospice is a Medicare benefit. It's covered 100% by Medicare, whereas death doulas, they're all private pay. Now for myself, I do have packaged bundles that can be, purchased. And also, I can work on a sliding scale. It just depends on what the situation is. And for hospice, there are licensed roles, licensed clinicians, technicians there. With end of life doulas, there is not a national board yet that regulates, what doulas do and how they can perform their practice. Although there are many different trainings that you can take to become a doula, with the National End of Life Doula, there's a code of conduct that is kind of, we all tend to follow. And that's just pretty much just maintaining our professionalism and providing the best care that we can. And so with hospice, again, the care is clearly defined. There they have a medical director, they have a case manager, they have other members on the team, and they kind of review every couple of weeks or so, the progress that's being made, what needs to be done, if there are any changes that need to be made. So for deaf doulas, again, it just depends on that training that that individual has. But again, we will also always support the care plan that was presented by hospice. And then finally, we know hospice provides clinical care, whereas doulas, mostly they're non-medical care and provide just practical care. So I like to say that end-of-life doulas complement the work of hospice by bridging that gap that does exist, so that we can bring the best possible care and service to the patients. Now, why did I become an end-of-life doula? I became an end-of-life doula because I'm passionate about educating and supporting and empowering others about end-of-life care. I've been in the healthcare business for over 35 years, with almost 20 years in nursing experience. I've been blessed to hold space for countless dying patients while supporting their families and their loved ones as they take their last breath. So consequently, I feel like I've been practicing as an end-of-life doula long before I even knew what that term was. And it's definitely been my honor to serve others in this capacity. What I do is genuinely done out of compassion. It is a heart service to me, and I feel that it is my true calling. So I have another quote in here by Ann Richardson, and it says, "We cannot change the outcome, but we can affect the journey." So with that being said, end-of-life doulas or death doulas, we understand that, this is end-of-life care. People have terminal diagnoses. We can't change that. But what we will do is, ride along that journey with that patient and the family and, take care of them with care and compassion and make this journey as easy as possible.
You had mentioned that you have been a nurse for quite some time. Are
Yes.
most deaf doulas nurses?
No, they are not. But from my experience and from just meeting other doulas, a lot of them have had, personal experience with death. A loved one, most or some have volunteered at a hospice agency. Um, so they're familiar with end of life concerns and issues and things like that. So no, not everyone is a nurse.
Okay.
It is not
Um,
required to be a nurse.
it's not required. Okay.
No, it's not.
Uh, you had mentioned that the optimal time or the time that you recommend to get involved with a deaf doula is a diagnosis. Can you kind of talk a little bit more about that as far as, diagnosis obviously is when you're diagnosed. I assume we're talking about terminal,
Terminal.
terminal
Yes,
diagnosis. Okay.
yes. With the terminal diagnosis, yes, doctor has said, if the disease or, progresses along its natural course, a patient may have 6 months or less to live. So I myself like to get in there at that time of diagnosis because it is difficult when you're given a diagnosis such as that. So I just want to be right there to be able to provide that support, a listening ear, guide them to resources, just whatever is needed at that time. I know in my experience, nursing experience, I've come across some that have had terminal diagnosis and want no part of hospice, which is okay. I mean, that's their choice. But for those that don't want hospice or not electing to sign on to hospice at that point, I think doulas can kind of just be that person, to kind of hold their hand until, if they do decide, and if not, they'll still have that added support.
Yeah, I want to follow up, if you don't mind, on that about the working alongside hospice. How does that
Mhm.
actually work with regards to splitting time? I know you said they're more medical, whereas a deaf doula is not. So how do you determine the amount of time to spend with a client, as they're going through this journey?
So that is something that's determined at the onset, at the initial consultation with the patient. If we're finding out at that time that they are on board with the hospice already, we would just like to trade that information and, make the hospice aware that we are also involved in the care, that we will work right alongside with them. We're not trying to take away anything from them. We're just an extra added layer of support.
Yeah. Is there a typical length or number of hours associated with a death doula as far as an assignment with an individual?
Um, well, again, all of that is determined at consultation, but I will say for myself, if I have a client that is active or transitioning, I'll just try to have one client at that time so that I can make myself available. Things change quickly during that stage. So I just want to be available, be it by phone, Zoom, in person. So not trying to spread myself too thin, but when I get a client that is at that stage, I'll only accept one at that time.
Yeah. I want to talk about your journey a little bit. Obviously, a nurse for many years, and you talked a little bit about the reason why you've kind of transitioned to end of life doula.
Mm-hmm.
Is what the reasoning? Was it because of the medical constraints, or is it the ability to provide more of that practical care? I'd like to kind of get a better understanding as far as your reasonings and why individuals would seek out a doula as opposed to, let's just say, a hospice individual.
Okay, and I think it's a little of both, of what you said, the time constraint and then wanting to provide that practical care. So I started out working in skilled nursing facilities, and I would see hospice nurses come in to see patients, but they were there for maybe an hour and then they were gone. Sometimes family members were present at that visit as well. Um, and then they still had questions. They probably were still a little uncomfortable with what was going on. Um, and as the visit is going on, they're not thinking of everything they wanted to ask or things like that. So I would find myself just gravitating to that particular patient and that family, and I would just sit there with them. Um, so that's where I think that gap comes in. Hospice is wonderful. I've been doing hospice for many years. It is a wonderful service. But again, it is regulated as far as time constraints. So doulas, whatever time we can work out with the patient and the client, whatever time is needed, we'll work that out. And as for me, I mentioned that I do like bundle different services together.
Hmm.
So for example, if someone only wants to hire me for maybe 10 hours of service, it does not necessarily need to be 10 consecutive hours. They might need me for an hour on this day, a couple hours on this day, however they see fit to work this out. And like I said, the journey is theirs. I'm there for them to, whatever they need.
And where does the deaf doula work? Is it in the homes? If somebody's in, the hospital, I assume that the travel goes wherever the patient is.
Yes, it would be wherever the patient is. More than likely, it would be in the patient's home, maybe an assisted living facility, a boarding care, a skilled nursing facility, pretty much wherever the patient is. Just with the understanding if they're in some type of facility that, the family has privately hired a death doula, and we will be, stopping in periodically or, as they see fit. Again, not to take away from anything that they're doing, just to complement and add another extra layer of support, extra eyes, extra ears.
I want to talk a little bit about COVID.
Yeah.
Um, what what in your mind, or how is the role of a deaf doula? How has it changed, or has it changed with the introduction of COVID and virtual versus in person? So kind of what was it before? Where is it now? And then maybe if you could look into the future and kind of put a crystal ball here and say, okay, this is the type of support I see that we could be providing that could be an extra benefit for a loved one and their family.
Yes, so with COVID, of course, the in-person visits were kind of restricted. So I know myself and some other deaf doulas that I'm aware of started doing virtual Zoom. And like I say, the work that we do is, it's all encompassing. It's very holistic, whatever the family wants and needs. So some things can be done over Zoom. Just that support, phone calls. You know, however they want to work it out. Of course, maintaining safety and being mindful of COVID precautions and things like that. So in the future, I see it continuing as it is. More of like a hybrid, either
Hmm.
in person or virtually. And I think virtually it opens up a lot more opportunity. Sometimes people don't, for whatever reason, COVID obviously, don't want to accept visitors into their home. So, willing to do the virtual method. So that works too.
Yeah. What are you mentioned typical household functions. Can you go a
hmm
little bit more detail? I assume that'll be something like what a home healthcare company provides, something along those lines as far as the non-medical?
Yes, yes. Maybe like some light housekeeping, could do a little errand running, just tidying up, light meals and things like that.
Okay. Now, do end-of-life doulas also support the families as well? So the personal caregivers. I know you had mentioned that, to kind of give one of the benefits of an end-of-life doula is to be with the individual, to kind of give that family member, that family caregiver, a break. Is the role of a doula as well to work with or to comfort the family as well as the individual that's on this journey?
Yeah, yes, definitely, definitely. Lots of education. We want to empower not only the patient or the client, but their family as well. It's the unknown. People are uncomfortable with it. They're afraid of what's to happen. Just there to be that guidance. You know, no question is off limit. If you just want to vent, just whatever is needed. I mean, we recognize that, this is being a caregiver is a lot. It can be a lot to deal with everything that you're dealing with. So we just want to be able to walk alongside with that caregiver and support them in any way that we can.
So I believe it said, Sharon, that a end of life doula, that our doulas, death doulas, are not regulated. Was that the right terminology?
Uh, yes, and by that I mean that there is no governing board that says you need to have X amount of hours of training
Okay.
to become a doula. Nothing saying that, okay, you can see a client, but you only have 1 hour, 2 hours with them. So none of that, which I think is good, and for death doulas and for clients as well, because we're just open. Whatever time is needed, we can work it out. Our schedule, their schedule. We can make it happen.
Yeah. So I want to stay with that if you don't mind. I know you said there's a couple different alliances.
Mhm.
There's two different alliances. Is that correct with the death doula?
As far as NEDA, the National End of Life Doula
Yeah.
Alliance.
It,
Yes, and there's several others that I'm
okay.
also members of, and we all are just collectively support doulas. We're all trying to raise awareness. We're all trying to support. We're even talking about establishing some collaborations. I mean, this profession is pretty new and it's emerging. So, for example, if I'm in my area and I'm available, I want to be able to have a directory that I can pull from and say, okay, I'm not available, but this doula may be available.
Yeah. For those that are watching this, as far as, can you help people understand the difference between like chronic versus terminal when they get that type of a diagnosis, and the role a death doula plays with those individuals?
Okay, yes. For those with chronic illnesses, it may be something like COPD, chronic obstructive pulmonary disease, where it waxes and wanes, where you have exacerbations, periods where you have difficulty with breathing, respiratory distress, medications can manage those symptoms for you. But there are some times where something triggers an exacerbation. So in that case, we would support that person with that chronic condition and just kind of come up with plans and ways to like conserve energy, just re-educate, reinforce um, the best way to manage that disease. And for those with terminal diagnosis, of course, again, that disease will run its natural course, and a doctor has certified that patient is terminally ill, 6 months or less to live. So there's no cure there. That person is not seeking any curative treatment versus going back to chronic. They have treatments that they're doing. They're taking medications, they're doing treatments to manage whatever that is. Terminal on the end, they're not. Other end, they're not doing anything to curative measures.
Yeah. So I know you had talked about hospice and
Mm-hmm.
the similarities and the differences between hospice and an end of life doula. Are there other professions that that are, you had mentioned, other collaborative type of industries or professions? Can you kind of talk a little bit about that, as far as maybe when you're at these conferences and these collaborations that you're looking to do? What does that look like, or where do you think things are going with regards to that collaboration?
I think it's going well. Collaboratively, I've come across some clergy, pastors, that have their own churches or whatever, and they have a ministry of end of life care, things like that. I've come across some social workers who are also in place for like resources and things like that. Um, of course, home health aides, caregivers, nurses, so all of that kind of overlaps. It's just a wide range of background for those who choose to go into this space.
Yeah. Can we talk a little bit about the care team? Now, as a nurse, you're familiar with the care team.
Mm-hmm.
How, as a death doula, when you enter a situation with an individual who's, let's just say they've received a terminal diagnosis, and people, the term palliative care and
Mm-hmm.
hospice and death doulas, I know you've gone into a bit, as far as hospice birth versus end of life doula. So
Mm-hmm.
if somebody's watching this for the first time and they've, them or a loved one has unfortunately received some type of a terminal diagnosis, how would a care team kind of, understand whether it's palliative care, how does that work?
So for that, everything is driven by the patient. Our initial contact is with that patient. And from that point, if we learn or when we learn that there's a hospice team or other medical professionals involved, of course, with patient's permission, we will collaborate with whoever is involved in that patient's care. Um, Sometimes they may allow us to, receive medical information, test results, and things like that. Just so that we can kind of go over, reiterate, what doctors and what other clinicians have said. We definitely all want to be on the same page. So, it's good to know who's involved in care, given that client's permission, family's permission, so that we can communicate with them and collaborate with them.
I think you had said that insurance is not covered with end of life doula. Do you, looking into the future, is there any type of a change with regards to that coming down?
Into the future, hopefully, I would say, but then again, with that, then we would have to go with the tight restrictions and regulations and things like that. We're kind of, okay with like the fact that we don't have so many restrictions, you know what I'm saying? As far as what we can do, how we can do, when we can do it. And again, everything is driven by that patient and their family. So I know a lot of other death doulas, they do have set rates and prices, but again, we just want to raise that awareness. let folks know that, there is an additional service out there at the end of life. So, we work on a sliding scale. I know for myself, I've given away some services, for free. It just depends on the situation.
Excellent. Well, this has been wonderful. How can people find you, Sharon?
Okay, let me see. Okay, there's my information there. My website is www.Serenity End of Life Doula, and that's Serenitydolifendoula.com. Email is care@Serenity End of Life Doula, and I can be found on Instagram at Serenity Doula. And I also have a Patreon account, Serenity Doula, where I send out some curated information and things like that.
And where exactly are you located in California?
I am in Murrieta, California. I service Riverside and San Diego counties.
Okay. And virtual?
Yes, I virtually as well.
Okay. Well, this has been wonderful. Thank you again, Sharon. As far as Knowledgeable Aging, you can go to knowledgeableaging.com, see all of our upcoming and archived webinars. You can find us on YouTube. I encourage you to subscribe. We update that a couple times per month. If the podcasts are your thing, you can find us on Apple Tunes, Spotify, etc. Until next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.